Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. We have joining us today one of our newest affiliate members, Sean Duffy with Omada Health. Sean, good morning.
Hey, good morning.
Hey, nice to have you here. Really appreciate you taking the time out of your morning to join us. Give our audience a little background on Omada Health, please.
Yeah, for sure. So Omada Health is a company headquartered in Silicon Valley, and our mission is to take the Valley's best design and engineering talent and focus them toward building really kind of rich, exciting, and engaging behavioral medicine programs, for people with a whole host of conditions. And our first helps people with prediabetes, so for folks who are at high risk for going on to get type 2 diabetes, but they're not quite there yet. It helps bring them through a lifestyle program that's based on this CDC initiative that shows that you can make a big impact on someone's health, and it's delivered entirely digitally.
Yeah, tell us that. If I'm an employer, what is really the importance of this type of program in helping me not only, in my productivity around my workforce, but helping me bend the healthcare cost curve?
For sure. So, as you know, diabetes is something that employers, do and should care about for a whole host of reasons. The first is cost, the second is productivity. And that, folks with type 2 diabetes, because it's a relatively intense care regimen when you have diabetes, tend to miss more work, in addition, to being, at higher cost for the employer. What's fascinating about this entire landscape is that, yes, it's very important to work with your employees that have diabetes and engage kind of best-in-class, providers to help them. But type 2 is entirely preventable if you focus on the right people in the right way. And, if you look at any given kind of population for an employer, about one in three of them are likely to have prediabetes. So that's a significant subsegment of your employee base. And those individuals are really barreling toward type 2 at a rate of about 5 to 10% conversion a year. And if you intervene, the evidence shows you can dramatically reduce that. So it's a great canary in the coal mine. It's a great way to focus, efforts around disease prevention in a targeted fashion to really deliver, real meaningful results. And that's kind of the message that we're shouting as is the CDC.
And Sean, one of the challenges with prediabetes is it's very difficult to be aware. I mean, most people are unaware of it, correct?
Exactly. That's correct. Yeah. In fact, about 90% of people don't know they have prediabetes, but that is changing. And employers can make a big impact there. Either via biometric screening efforts. There are risk surveys that can be used to give a pretty good indication if someone's at risk. So those tools can help, and employers can be a vehicle to spread awareness.
Sean, when you look at wellness programs, is a general wellness program something that can combat prediabetes, or does it need to be richer than just a general wellness program?
It's interesting, and timely in that the U.S. Preventive Services Task Force actually just put out a guidance that really studied a lot of DPP and DPP-based programs for people with prediabetes and other risk factors. And I think a wellness program can absolutely help. That is true. What is typically seen in the research is that in order to really have a meaningful effect on the health of someone with prediabetes, you have to really go all in with them and bring them through an ultra high touch, targeted, structured program to make the impact that you need to have. And so what we find in the way that we work with employers is really kind of under or alongside a general wellness program, which is important just for the overall population health for an employer. But we just take a little bit extra care for those at particular risk.
Now, you mentioned something here about the National Diabetes Prevention Program. What is that?
So that's an initiative that's kicked off by the CDC. It was actually funded in the Affordable Care Act a couple of years ago. And the vision is that there's an extraordinary amount of science that shows you can prevent type 2 diabetes, but that science has not really been brought to the country in the way that it needs to. And there are very specific programs that are shown to help. And so the CDC basically looked at the research, created standards for what the best program should look and feel like, and created really a yardstick that organizations who want to deliver that program can use to measure themselves against it. And so, this is kind of an ongoing effort, and they're working to create a world where the second step for anyone who's at risk for type 2 is to go through a program based on their standards.
Okay, and so this is the seal of approval that if I'm an employer, I know I'm getting into what could be an accredited type program.
Yep, that's right. And the questions to be asking if you're an employer and you're interested in diabetes prevention, and you're talking to folks who want to help you with that, are really what are your outcomes? What are your outcomes? In contrast to what the CDC requires, they have ways that they ask you to report the standards. So that's something that any provider should be able to deliver. And do you hold to the standard? So it's a great way to discern really a baseline level of quality. If this is an effort that you're looking to roll out.
When you look at kind of criteria inside of these programs, what do you personally recommend that employers kind of look at in terms of criteria for evaluating their programs?
So I think there's a couple. If you look at just the funnel of how people get in, is the organization good at helping people understand their risk, recruiting them in? Are their marketing campaigns thoughtful, orchestrated, and engaging? So it's what percent of people who would be eligible can get in, because it's important to make something that people want to do. And then once they get in, there's really two measures. A, can you get them to the point where they're finishing the curriculum and actually going through the lessons, going through the courses? And then B, and most importantly, are you getting to clinically meaningful weight loss through that program, which typically occurs around 4 to 6%. So you want to evaluate it in those two domains. And then also just understand what the experience is going to be like for the person. If this is something that your employees will be excited by, will kind of talk about, does it deliver kind of a cultural value as well?
And Sean, this digital therapeutic program around prediabetes, your product is called Prevent. Is that correct?
Mm-hmm. Yes, that's correct. Yep.
And what's it cost if I'm an employer? What is the business model? What's the pricing model?
And so that's it's an awesome question, and and that kind of fits into your previous question around the criteria too. In that us and other companies that are really pioneering this category of digital therapeutics are pricing on performance and not PEPM at all. So when we engage with an employer, we don't charge anything. There's no PEPM. We only charge on milestones for getting people through the program, and we actually only make money when we get people to clinically significant weight loss of 5% or greater. So we have a pay-for-performance model. We can bill into the medical spend based on ERISA laws, and the program it could cost as little as $100 if we're not doing well. More typically, if we're doing a pretty good job, the core programs between $400 and $500, which is a really intensive program over the course of 16 weeks. With coaching, equipment, kind of, the full package. But again, if we don't get results, we don't charge.
That's excellent. How long has this program been out there, Sean?
We've really gone through 3 phases at Omada. So, we were piloting even 3 years ago just to do research, really, to see if our program might be successful. Commercially, about 2 years.
Okay.
And, at this point, we work with, a whole host of employers, actually, and plans and providers across the country.
Now, Sean, when you look at, there's a lot of need for human touch out there and a lot of hand-holding. Is that something that you do with your program and platform?
Yes, there is. You're spot on. There is a need for that. It's when we were founding the company, we started by just reading really the methods kind of papers behind how the most successful programs like this were done in a face-to-face setting, and what you quickly find is that you can't take the human touch out of it. In fact, social relationships, and accountability between people are the things that are actually most important in these programs, and you can use technology to scale them. So, we take people with prediabetes, we match them up into these small groups where you're with other people like you. We pair them with a health coach, and we kick them off on this timeline where they're going through the curriculum, and all of it is centered around social, which is exceptionally important. Otherwise, you actually don't, it's very tough to get results.
Now, Sean, when you kind of look into your crystal ball, what's next for Omada Health? Where's this platform going, and are there some other preventable chronic conditions that you're going to be addressing?
Absolutely, and the way we look at this is really in 2 categories. So we are a company that will be have multiple programs, so we can absolutely serve as a one-stop shop for an employer who wants to bring best-in-class behavioral programs to their employees. The way we'll get there, is likely in first building things that are adjacent to our prevent program. So other, lifestyle intervention, weight loss programs targeted toward different risk factors with, different approaches, but very similar concept. And then, on the other side of that, other things where there's behavioral science evidence that shows that you can make a very positive impact in someone's life. And we'll take that and then bring it to the digital world. So, the categories of things in that are, smoking cessation, mental health, other things that could benefit from a behavioral science intervention.
Sean, we really appreciate having you on the program. We've got about 30 seconds to go, and I want to give you an opportunity to leave our audience with a thought or two.
Sure. So, I would say again, I want to reiterate the opportunity that prediabetes affords. It's entirely preventable. A third of anyone's workforce, and taking an active stance now can do an amazing amount of good, not just for the individuals, but for the bottom line.
Hey, Sean, really appreciate you joining us on the program today. Let our audience know how they can find you.
Yeah, absolutely. So our company is Omada Health, which is OMADA Health. So you can search on Google for that, or just go to omadahealth.com.
All right, great. Thank you so much for joining us. And to our audience, Omada Health is an affiliate member of the Institute for Healthcare Consumerism, and you'll be able to find their information on our homepage as well. And, Sean, have a great weekend. And to the rest of our audience, we'll talk to you next Friday on Healthcare Consumerism Radio.